A lot of people have this myth attached that maybe if I, retrieve so many eggs out of my body, it'll probably lead to infertility. What is the right AMH for someone to maybe get qualified for an egg freezing process?
The process from starting of injections till the retrieval or taking out the eggs from the body is a 14-day. So there is a bank balance out of which few eggs come for selection. And from that cohort or that crowd, only one gets selected. This is the natural process.
Are there any specific complications when it comes to pregnancy or egg freezing with women having PCOS, PCOD?
Many companies do offer egg freezing as a part of their health insurances.
So if I have low AMH, can I do anything about it?
IVF is kind of an end treatment for people who are trying to conceive.
There's a lot of conversation around IVF being painful.
Success rate is going to be dependent on how many eggs we've frozen.
Typically, what is the cost of freezing my eggs?
About artificial womb, that is still a science that is yet to be developed. I don't see that happening.
Hi, Dr. Shivika. Welcome to the Namya podcast. I want to directly come to the conversation around egg freezing, since it's something that people still have a lot of apprehension around, and there's a lot of myths around egg freezing today. मुझे सबसे पहले आप ये समझाओ कि egg freezing होता क्या है?
So, one very basic thing, even before we dive into egg freezing, is something that I want all women, all females to know, that there is a set number of eggs that we are born with. When we were inside our mother's womb, God had already made our ovaries and they had a fixed number of eggs. That number is quite huge, 1 to 2 million. As we hit puberty, when we are born and when we hit puberty, from that very moment, the day we start getting our periods, our number of eggs start declining. So when we reach at a stage, say in our 30s, in our mid-30s, maybe 35, that number drastically comes down to being in 35,000 or 40,000.
Right.
So when we are placed in such areas of our life where we don't have a partner, where we are not sure whether we want to get married or not sure whether we want to have a baby, or we have career commitments or educational commitments, and we are not ready to have a baby at that moment, but we do wish to have a baby, it's most advisable we freeze these eggs.
Okay.
So it's the science of freezing eggs at a younger age to be used at a later stage in life.
Got it. And a lot of people also, I think, don't do it because they feel that maybe it'll cause them infertility if they do it younger, right? So there is a very soft space where you can have babies, you can get pregnant. But a lot of people have this myth attached that maybe if I, retrieve so many eggs out of my body, it'll probably lead to infertility. How much of that is actually true? And what would you want to talk about it?
So this is totally a myth. There is no correlation between freezing your eggs and then getting infertile later on. The whole purpose of freezing of eggs is to have a baby in your later stage in your life. But when we compare the two processes, so when we are freezing eggs, we are just taking those number of eggs that are coming forward in a particular cycle, in a particular month.
Okay.
The rest bank of eggs, I would say the FD amount of eggs is still there. At any stage in your life, if you want to have a baby, you can use those eggs. And God forbid, if you don't get pregnant with those eggs, you can use the frozen eggs to get pregnant.
Right. And the age of the egg that you've frozen today, are you saying that still gets maintained over a longer period of time?
Yeah, so when we are freezing an egg, for instance, there is a female who's frozen her eggs at the age of 32 or 33. Then she comes back to us at 38 or 39. She wants to get pregnant.
Right.
When she's 38 or 39 and we have a frozen egg, that egg is 32. So the frozen egg is put into cryopreservants, which is going to stop the biological activity or the growth of the eggs. Okay. So it gets preserved. So even though she is 38 or 39, her egg remains 32.
And what exactly happens? What is the process like? Like, how do you preserve the egg? What is the freezing, process like?
Okay, so the whole process is divided into two parts. The first part is called as ovarian stimulation.
Okay.
This typically begins on the second day of a period cycle. We would want the female to come to us. We do an ultrasound. We see what are the number of eggs in both the ovaries, which is determined by two things. One is a blood test called AMH, and the other thing is done by an ultrasound. We see the antral follicular count, that is AFC.
Okay.
Once we determine both these things, we start giving injections.
So I have a question
Yeah,
here.
sure.
So ideally, what is the right AMH and AFS for someone to maybe get qualified for an egg freezing process?
So there is nothing, there's no ideal number to qualify as somebody doing egg freezing. Anybody can do egg freezing. Okay. We offer it more to people who have a lower AMH. Why? So that they have the bandwidth to freeze them and to use them at a later stage.
Okay.
The idea is to preserve the dying follicles or the dying eggs. So there is no bandwidth that only this amount of people in this AMH can do.
Okay.
AMH is a quantification of the number of eggs. So it tells us how many number of eggs are left behind in our ovaries.
Okay. And so ideally, what should be my AMH below which you will suggest that I need to probably go for an egg freezing ASAP?
So the correct values or the ideal AMH is between 2 to 5.
Okay.
So if we have an AMH of 2 to 5, the number of eggs produced every month will be somewhere around 10 to 12 or maybe 15.
Okay.
So this is a very good ideal number. Somebody in her 30s, maybe early 30s, 30 to 35, having a lower limit of AMH, should freeze her eggs. By lower limit, I mean less than 2.
Okay.
Should definitely freeze.
Okay.
Having said that, this call of freezing eggs or not freezing eggs should not be taken on basis the AMH. The parameters to freeze your eggs should be different.
Okay. And these are?
Where are you placed in your career? What is your relationship status? Another, do you want a baby today or maybe tomorrow or in future and not ready at the moment? So these are factors that decide, and then correlate it with your AMH. Somebody with all these things in mind and with a low AMH should do it ASAP.
Okay. I have a question. So let's say I don't have a plan in terms of what I want to do or wish to do for the next 3-4 years. And let's say my age is say 30, 31, 32. And of course, I think the moment you hit a 30, that's what I was researching, that the eggs drastically drop. At this point of time, at what stage in age should I actually decide to do it, irrespective of what else I'm doing? So let's say my next 3 years are uncertain, irrespective of whether it's my relationship, my career, and I'm already hitting a 30, right? So technically, what is that sweet spot of age where I should probably decide to do that? ASAP. And the eggs or the fertility potential of a woman, when does that drastically drop down?
Indian women, if we specifically talk about, 33 is a very critical age. 33 to 35 being the age group, but 33 is when the changes start developing.
Okay.
So the quality of egg post 33 or majorly 35, there's a steep decline in the quantity as well as the quality.
Okay. Now take me through the process of how does this happen? Let's say today I come to you and I want my eggs frozen. What is the time duration? What is the process like? How many times do I have to visit the hospital? What is exactly the process like? Just take us through that.
Yeah, sure. So I would want anybody wanting to do egg freezing to come to me on the second day of their period. Maybe we can have a consultation initially.
Okay.
The process starts on the second day of your period, where we do an ultrasound. We determine the number of eggs in the ovaries. If everything looks good on a scan or on an ultrasound, we start injections. These are hormonal injections, also called as gonadotropins, which are given every day. Their sole purpose is to grow whatever number of eggs are there in the ovary. Physiologically, our body produces only one egg. But we cannot be freezing one egg for the purpose of egg freezing.
Right.
We would want multiple eggs to be frozen. So that's the idea of giving these injections.
Okay.
The process from starting of injections till the retrieval or taking out the eggs from the body is a roughly 14-day procedure. In between these days, I would want to do an ultrasound to monitor the growth a minimum of 2 or 3 times, which gives us an idea what dosage is required, any additions are required, any specific injection to be added. At the end of 2 weeks or 14 days, when the eggs are ready, they are 18 to 20 that is a mature egg, we trigger them, further mature them, and then after 36 hours, we take them out from the body by a very small OPD procedure that's called as egg retrieval, done under short general anesthesia, doesn't require overnight stay. Maybe you come in the morning, we do the procedure, 20 to 30 minutes is the downtime, and you're good to be discharged by the afternoon.
Understand. And while I kind of do that, are there any side effects of these hormonal injections that are given?
See, they are injections, they are hormones, they do something to the body apart from growing eggs.
Yeah.
But present day science of growing your eggs is really advanced. The injections don't go up till those levels that will have major side effects. The maximum what we observe is constipation, bloating, water weight retention, breast tenderness, maybe an exaggerated PMS symptoms that we would want to call it.
Okay.
Right after the pickup, when you get your period, mostly all the hormones are flushed out of your body.
Okay, understand. So you're saying that whatever side effects your body has, it is for maybe the next cycle and then it kind of goes away.
The present cycle.
And does it affect your further period cycles in any way?
Ideally, it should not. But having said that, everybody has different period cycles. So everybody responds very differently to the injections, to the procedure. It wouldn't be wise to say that, okay, for everybody the periods are going to be normal. Maybe, may not be.
I understand. But you're saying that these are very temporary.
Yeah, very temporary.
Side effects.
It's not going to have a long-term side effect on your body.
And you're saying that it's also not going to affect your fertility rate.
Future fertility,
such.
Yeah.
Got it. And typically, does it happen, the success ratio happens at the first shot, or does somebody has to try the next cycle as well?
So this depends upon what is your AMH.
Okay.
If we aim at having one baby, we aim at freezing a minimum of 12 to 15 eggs.
Okay.
And if we aim at having 2 babies, we want 18 to 20 eggs to be frozen.
Got it.
So if somebody has a good AMH, falling between 2 to 5, we do look forward freezing 12 to 15 eggs. So maybe they're not required to do this one more time. But somebody with a lower AMH, the number of eggs we take out in one go is going to be lesser. So when we have less number of eggs, it is advisable to freeze at least 12 or 15 eggs so that the success rate of having a live birth is maintained.
I understand. And you're saying that does the complication also kind of double up because you're going through 2 cycles?
Every cycle is going to be different. There is not going to be a cumulative effect or an additive effect. Okay. So if one cycle you experience bloating and constipation, maybe those will be similar side effects you experience in the next cycle. Now that we're doing it the second time, it's going to be higher.
Okay, got it. I understand. So technically, if I kind of understood it right, then your AMH does not affect so much because you're anyway going to inject it externally to get to that size. Is that correct?
So AMH is number of eggs.
Right.
When we're giving injections, we are growing whatever eggs are present in a present cycle. So there is a bank balance out of which few eggs come for selection.
Right.
And from that cohort or that crowd, only one gets selected. This is the natural process.
Right.
When we are giving injections, we are concentrating on this crowd that's come for the audition.
Right.
That FD or the bank balance is intact.
Understand.
Injections are not affecting your ovarian tissue. It's only affecting the ones that have come forward. Otherwise, if they are not selected, they die. Right. So every cycle, these 10-12 eggs are dying.
Right.
What we're doing is we're taking them out, we're preserving them, and then we're freezing them.
Got it.
That's what we're trying to do.
Understand.
So if anybody thinks that my fertility will be affected, they should be rest assured that the cortex, the place where we have the FD of these eggs, that's not been touched even.
Okay. And let's say today I want to decide for egg freezing. How should I be taking care of some elements of my nutrition, diet or health, and how early should that start?
So on this, I would want to say very basic things. I think everybody knows about this, but how much do we practice in our day-to-day life is something that we need to really think over. Sleep, 7 to 8 hours of sleep. Not that we're sleeping at 1 o'clock and getting up at 10 o'clock. That doesn't count as a good sleep. Sleeping at around 10 or 11 and then, completing your 7 to 8 hours sleep.
Yeah.
Second, I would want to focus on diet. A diet has to be very rich in protein. That's the building block. And any repair or tear that happens in our body, it tends to overcome that. Thirdly would be exercise. We need to have good physical activity that releases good hormones, maintains our hormonal levels, so that everything in our body is in sync with the biological clock. So these are 3 basic things that I would want everybody to be doing.
Okay.
And also not to forget stress management. How much stress revolves around us in our personal lives or professional lives or in our day-to-day activities does affect the ovaries. Our ovaries are the most tender organs, I would say, the way we age, like our skin ages, our hair ages, the same way the ovaries are aging, and they're very fragile. So all of this is all aimed at improving the egg health.
There's also a lot of conversation now around DHEA, CoQ10 and other supplementation. How important are these?
So here we are talking about 2 different classes of supplements. So CoQ and folic acid, these are all antioxidants. So their main focus is to create an environment that is in our body that is rich in antioxidants. Any free radicals that are there in the body. So free radicals are produced as a result of our body systems because of pollution, because of our metabolisms. So that needs to be flushed out. So because it's a toxin, it's going to have negative effects on the ovaries. These antioxidants are only enhancing the process of the egg freezing by improving the quality. When we talk about DHEA, it is a form of testosterone. There are various studies that say that some amount of testosterone in our body helps boost the eggs. So that we use in people who've got very low AMH, 0.3, 0.4, 0.5. It can be a placebo, it can have beneficial effects. In my clinical practice, I have seen it doing good effects. The literature is very vast. Some says it does have good effects, but some people don't consider it doing good.
Got it. And since you were talking about testosterone, women with PCOS, PCOD already have like high levels of it. So would that not be a little counter?
So in PCOS, the number of eggs is very good. We don't aim at giving testosterone in a woman with PCOS.
Okay.
It is aimed at giving to someone who has a very low AMH. So somebody with a good AMH or above 5 AMH doesn't require them. So PCOS women has an AMH above 5, mostly. Okay. So they generally don't require it.
Right. And are there any specific complications when it comes to pregnancy or egg freezing with women having PCOS, PCOD? Because a very common conversation around is that women with PCOS, PCOD do have issues getting pregnant, right? And I think it makes a lot more sense for them to probably freeze their eggs. So is it different or the same process for them? Are there any specific complications for them in the process?
So in PCOS, there are a lot of eggs. All of them are competing with one another because there is a hormonal imbalance and there is not one mature egg. That's the reason why they're not able to get pregnant.
Right.
So when we try to stimulate them or give them the injections for egg freezing, they produce a number of follicles or a number of eggs. But sometimes we do end up not getting so many eggs because some are false follicles. False follicles means they don't have good number of eggs or good eggs inside them. Second, these are the people who can over-respond or overreact to the injections. So we have to be very careful when we're giving them a dose. That's where the importance of a scan and an AMH comes. The dose has to be given in a way of the injections that doesn't complicate things for them.
Okay. There was also something that I was reading about. It's called OHSS. This is
Hyperstimulation syndrome.
So what is that about?
So OHSS or ovarian hyperstimulation syndrome means that somebody has overreacted to these stimulation injections. Okay, when we give so many injections, a lot of hormones are produced in the body. There is a lot of LH, there is a lot of estrogen in the body. Suddenly we are taking out these eggs, so it causes a lot of other complications. There is collection of fluid in the stomach, maybe in your lungs, maybe in other parts of the body. There can be over distension of the abdomen, breathing problems can be there. Then if it goes to severe cases, can start affecting your coagulation profile, your kidney tests or your liver function tests. So that's something very severe. But having said that, given present day injections or present day practice, it doesn't usually happen, you know, because we give very regulated doses of injections. And injections are very superior these days. So OHSS, a very severe form, is very rare to see. Also, there has been some change in the way we are taking out the eggs. Like we have to give a trigger injection. The protocols that are used. So with these things, we monitor them. We use a lot of caution so that OHSS does not happen.
Okay. Talking about, you were talking about the process that has changed. There's also now vitrification that is happening, and it's very different from how it used to happen earlier. Tell us a little about that.
So traditional way was a slow freezing method, where slowly the temperature was cooled over for the eggs or the embryos, and then it was put in liquid nitrogen. But now is called, what we practice is vitrification for majority of the labs these days. So the embryos or the eggs are put into a cryopreservant that is highly concentrated, that immediately it's going to be put into liquid nitrogen and then frozen at minus 196 degrees.
Okay.
So this is a much superior process and gives us a good thaw-back results. When we thaw them, we get a good comeback result.
Got it. And if I've put the egg, if I've frozen it, what is the life of that egg?
Once we've frozen the egg, we kind of arrest its biological growth. There's no cell growth. Okay. So unless we thaw them, we cannot, nothing is going to happen to them. But medically, there is ART that says the regulatory body, it says that in India we can freeze eggs or embryos for a period of 10 years.
10 years, okay. And let's say I don't choose to use my eggs. I got it frozen for, let's say, 10 years. Can I give it to somebody else? What happens to that egg is what I want to understand.
Presently not allowed in India.
Okay.
But let's hope for some changes or amendments.
Any reasons why it's not allowed? Let's say I willingly want to give it to somebody.
See, these are gametes, okay? There is a lot of malpractice also around it. A lot of... before 2021, we did not have an ART law. Post 2021, we have an ART law that regulates majority of the things that we are doing in IVF and infertility. So before that, anybody and everybody could be doing these things. There were malpractices. There were people illegally using them, maybe exploiting people for egg donation or embryo donation. So that is why our the regulatory board has put restrictions on these things.
Okay. So let's say I want to go today and decide which hospital should I, go and kind of get my egg frozen. Is there a list or is there a checklist that I can probably look at before I decide which is a safe hospital for me?
So as I was mentioning the ART law, so ART law has put down some guidelines for being, so there are two types of centers, level 1 and level 2. Some center that is doing egg freezing or IVF has to be a level 2 center. So first of all, that center needs to be registered with the national ART board, has to have permissions from the state ART boards, then has to have certain other permissions, NABH, ICMR, ISO, these all accreditations the lab should have. Then the staffing. should have a gynecologist or an infertility specialist, should be MD, MS in gynae, OBS in gynae, with infertility training or experience in ART or reproductive medicine, should have an embryologist. MSc.
But how will I, as an outsider, how would I go and check maybe whether they have like an embryologist or
so
not?
So these all details, if you want to know about a lab, these all details are online. They're on the websites. So anybody asking for a permission, they put in all these informations on the website or on the website of the National Registry Board or the State Registry Board.
Fair enough. And are these covered under insurance?
Major companies or corporate chains do cover. There was a time when egg freezing was not covered, but now this has come as a very good welcoming change. So many companies do offer egg freezing as a part of their health insurances or the facilities that they do provide to their employees. But yes, I have seen major insurance companies do providing infertility services.
Okay, got it. So if I have low AMH, can I do anything about it?
Again, we need to understand the basics. We don't have a egg production mechanism. We are blessed with a number of eggs. So low AMH means that number has come down. Unfortunately, we cannot increase that number.
Okay.
We can just maintain a good number.
And what are the top 3 things that I can do maybe to maintain my AMH?
Avoid smoking. Any form of smoke,
Right.
be it pollution smoke, be it active smoking, passive smoking.
Basically leave Delhi.
Put in a good way.
Yeah.
So second, as I rightly focused, previously we talked about diet, rich in protein, including more estrogenic foods, like maybe seeds in our diet, maybe soya in our diet that have good estrogen and flavonoids. Thirdly would be exercise. A good lifestyle. In short, a good lifestyle.
Good lifestyle. Got it. Understand. I want to now shift the conversation a little bit towards IVF, which is still a far more mature concept in India now. First of all, who needs an IVF?
So, IVF is kind of an end treatment for people who are trying to conceive. Okay, a married couple trying for maybe over a year, not able to conceive. We run them through tests, so we run them through certain treatments. Like first would be follicular monitoring, then asking them to try naturally, then doing IUI. If these things are not working out for over a period of 6 months or of over a period of 1 year, then is when we try and divert the whole treatment towards IVF.
Okay.
Having said that, there are some indications where we do IVF in the first go. Could be blockage of tubes. Tube is a place where the egg and sperm meet. So there are again 2 schools of thought. Some people say tubes can be opened. Some people say it cannot be opened. Ideally, IVF was invented for blocked tubes. So that's a short indication for somebody to do an IVF.
And let's say some couple wants to go for an IVF. Typically, what is the process like?
Okay. So again, the first part remains the same as egg freezing. Day 2 of your period, you come for a scan. 10 to 12 days of injections. 14th day will be egg pickup. The difference here is there we are freezing the egg. Here we are taking the egg. That day we take the partner's sperm. We make them meet. That's called fertilization, done by either ICSI or whatever techniques we would want to use. We make an embryo out of it. And then we make that embryo grow from day 0 to either day 3 or day 5.
Okay.
And then freeze it. So the embryo is going to be frozen here.
Okay.
Then comes the second part to it. That is transfer back of that embryos into the uterus. The next cycle, whenever you get your period, we transfer those embryos back into you.
Okay. But why is it called so painful? There's a lot of conversation around IVF being painful. Which part of it is painful?
There have been a lot of taboos around IVF because it came out as something that was not natural. So there are people, who would say that it is a very taxing process. 3 months of bed rest is there. There is a lot of pain. The pain only is because of the injection. So whatever is your pain threshold. If you cannot tolerate injections, maybe it is going to be very painful to you.
Okay.
But these injections are very small injections. They are not big syringes that go into your muscles. These are subcutaneous injections. As small, I would say, as insulin injections. So the pain is only around the injection part to it. The procedure is under anesthesia. The transfer is a very milder procedure. So that doesn't require any injections.
And typically, how many cycles does a couple have to go through for a successful implantation?
This is a very subjective thing to talk about. Number one is the number of eggs, AMH. Again, it comes down to what is your number of eggs. Somebody with a lower number of eggs will have to do it 2 or 3 times to get good embryos. Somebody with a good number will have good number of eggs, good number of embryos is going to be formed.
Okay.
Secondly, what has been the success rate for a particular cycle? Sometimes in one cycle you may form embryos, sometimes you might not form embryos.
Okay.
So these are the things that decide what is the number of cycles that you might have to undergo.
Okay. And typically, what is the success rate, which is that today if I've got my eggs frozen, what are the chances that tomorrow I'll be able to have a baby? What is the success rate of having a baby in case of egg freezing, and what is the success rate when it comes to IVF?
These success rates are very lab subjective. A lab maintaining a good QC with all checks has a very good success rate.
Okay.
When we have eggs, for example, we want one baby. If we have 12 to 15 eggs frozen, later stage when we thaw them and we want to have a baby, that success rate is going to be dependent on how many eggs we've frozen. 10 to 15 eggs has an 85 to 90% chances of giving you a baby.
Wow.
Vis-a-vis when we talk about embryo, 10 to 15 eggs will roughly make 4 to 5 good embryos. The quality of the embryo decides the success rates of having a baby. Even in egg freezing, ultimately the quality decides. But when we want to compare egg freezing to a baby, and here we compare embryo freezing to a baby. If it is an excellent quality embryo, a good lab with all checks maintained can give you a success rate of good 70 to 80%.
Right.
When we talk about global rates, it is 40 to 50%.
Why are the global rates so less?
All labs are differently maintained. All labs have different practices. The way an embryo is formed, the way fertilization is done, the way freezing is done, the way thawing is done. So each and every step plays a very important role in defining the success rate.
So for somebody like, most of us are not doctors, and what are those 3 or 4 things that one should probably look at before they kind of choose? Because this seems like a lot dependent on the lab.
It is actually dependent on the lab.
Okay.
See, infertility specialists would be the face of it, but actually the magic is happening in the lab.
Okay. And so, let's say, what are the top 3 things that one should look at before deciding?
A lot of thing goes in by the lab QCs that they check. See, there can be standalone labs. There can be corporate chains running it.
Right.
So somebody with a good lab setup where people can have reviews of how good the pregnancy rates are. That is something that needs to be taken care of. Somebody offering maybe cheap prices shouldn't be a criteria for a couple to go to a lab. Somebody offering value work should be one of the topmost criterias for going to a lab.
Okay. And typically, what is the cost of freezing my eggs, and what is the cost of an IVF process?
So egg freezing process should be roughly between 1 to 1.5 lakhs. That depends upon lab to lab, because of every lab has got different ways of monetizing it. When we talk about IVF, again it is lab to lab. Should range somewhere between, one cycle should be somewhere up till 2 lakhs, 1.7 to 2 lakhs.
Okay.
As the cycles go on, the prices will go higher. And why IVF is a little expensive? Because it involves a transfer, it involves making of an embryo, the freezing of an embryo, the other methods of transfer, the other things also. That's why it's a little expensive than egg freezing.
Egg freezing. But what has better success rate? So today, let's say I have a partner and I also have an option to maybe freeze my eggs. what is a better way of doing it?
So again, here we have two school of thoughts. When egg freezing, the science of egg freezing was developing, then is when this thing had started that maybe embryo freezing is much better than freezing eggs. It was being preserved for people who were undergoing maybe cancer treatments, you know,
Right.
who had no other option than to freeze their eggs because they had to undergo chemotherapy or radiotherapy.
Right.
Present day, even this science of freezing eggs is very advanced. Injections are advanced. The procedure is advanced. The vitrification is advanced. So there are studies that say that probably there is not much of a difference in freezing eggs or freezing embryos.
Okay. You know, so we have so many conversations around an artificial womb that Elon Musk has created, right? There's just so much that's happening in this space now. Where do you look at, you know, maybe 5 years, 10 years down the line? What do you think is going to be IVF and egg freezing, you know, progressing into?
Presently, AI is been doing a lot of things for our science, infertility and IVF. AI is trying to tell us how good an embryo is going to be. We have embryoscopes that can look in the quality, the way the embryos are growing, can help us choose the eggs. AI is also helping us in deciding protocols. What is the right amount of dose a person should be taking? So AI is doing a lot. When we talk about artificial womb, that is still a science that is yet to be developed.
Right.
I don't see that happening at least in 5 years.
Got it. So let's talk about
was practiced was a fresh embryo transfer. That is, like, we make eggs, 14 days of injections, an egg is made, egg is taken out, sperm is taken, embryo is made. On day 5th, so the day we take it out is day 0. We let it grow for 5 more days. So day 5 when it reaches, then is when we put that back into the uterus. So this is called a fresh embryo, fresh cycle, where egg pickup and transfer is done in the same cycle. The second category is where we take out the eggs, we make them meet with the sperm, make an embryo, freeze that embryo, put it later on in the uterus. Maybe the next month we put it back into the uterus. The cons of a fresh cycle is when we are putting that embryo, many a times the lining or the embryo lining or the uterus lining where we have to put that embryo is not ready. As important as eggs are or sperms are or an embryo is to getting pregnant, lining is equally important because that's the bed or that's the nurturer of the embryo. So many a times in fresh cycles the linings are not ready. Your internal hormonal status is also not good. We've given hormones, maybe that interferes with our internal hormones. That also affects the implantation, your pregnancy rates. This is something we can't manipulate or adjust in fresh cycles. Vis-a-vis when we're doing frozen cycles, we get a month to prepare the lining. We get time to grow the lining steadily. A good pattern, a trilaminar pattern, where we know the hormones are not going up, down. We can check hormones. And I don't know how right I am in saying that. When we are doing fresh cycle, God forbid if it comes negative, we are losing on those embryos. Which we might not be losing on in a frozen cycle. Because we've had done all our checks, lining check, vascularity check, hormonal levels check, and then we are putting that embryos. We are like putting them to good use. And sometimes for some couples, like when we make a lot of embryos, more than 2 embryos, we can freeze the rest of them to be used in the next cycles. So that way the embryos are not waste. Sometimes we want to do a pre-genetic testing on the embryos. We would want to wait for the test results to come. Somebody coming in with a history of abortions or miscarriages or failures or a genetic problem. We want to test that embryo and only then put that back. Then is when we also encourage frozen cycles. We test that embryo, freeze it. Once the report comes, then is when we put that back into the uterus.
Got it. I also wanted to cover PGT. And what's that really about?
So PGT means pre-genetic testing. So when an embryo is formed, we can do a testing, a small biopsy of the outer cells of the embryo, where we can check the genetics of that embryo. An embryo is a 32 cell stage embryo. So it has all genetic, the chromosomal analysis can be done.
Okay.
By doing this chromosomal analysis, we can get to know if there is any genetic problem in that embryo. Many a times even IVFs become unsuccessful, and majority of the cases IVF failures or abortions or any other problems are accredited to the genetic abnormality of the embryo. Somebody with a history of miscarriages, history of IVF failures should ideally do PGT.
Okay. And there's also a lot of conversation that, that if you will go for an IVF, there is a high chance that you'll have a doublet or a triplet. A lot of people have twins. How common is that and why?
So when we're doing, why that happens is, we need to understand that first. Because we're putting 2 embryos or 3 embryos inside the uterus. Presently, what majorly every clinic follows is putting 2 embryos. So when we are putting 2 embryos, sometimes both the embryos stick to your uterus. So that develops into twins.
Okay.
That percentage is less. Out of 100 pregnancies, it would be 15 to 20 pregnancies. Just a 15-20%.
That's still at 20%.
Yes.
Okay.
Yeah.
And for precaution, is that just precautionary that we have to?
That is done majorly to increase the success rate of the pregnancy.
Okay. Understand.
Countries like US or Dubai or Thailand, they don't practice this. They test the embryo and put only 1 embryo. So many countries, they follow this practice, and even in India, some clinicians follow this. So this is a very welcoming change that everybody is trying to adapt. Single embryo transfer.
And is that something that a patient can ask for?
Yes, keeping in mind the success rates would be lower than transferring 2 embryos.
Understand. Got it. I have another question, which is, can donor eggs be used in IVF? And what about embryo donation?
When we talk about donor eggs, definitely we do practice that in India. So somebody with a very low AMH, for somebody when we've run cycles on them, when we've done stimulation for them, and if we are not able to make their eggs, maybe it has happened once, twice, thrice, or somebody with no eggs at all, then we are only left with the option of egg donation. Like we borrow eggs from somebody else. We stimulate the donor, we take out their eggs, we take their partner's sperm, make an embryo, and put that embryo back into the female.
Okay.
That is how the egg donation process runs.
Okay. And do you have to run through a legal process for this?
Yes. So egg donors are run by some legalized corporations or agencies that are egg donation companies. Okay. They do a lot of checks and they maintain forms, they get donors. There's a proper testing that is done on them. Their qualifications are checked, their health status is checked. Only then we take donors.
So with this, we come to the end of the section, which is called the rapid fire section.
Okay.
And this one is going to be myth busters. So I'm going to ask you a few questions and you're going to tell me whether it's a myth or it's a truth.
Sure.
So the first one is, egg freezing guarantees pregnancy later.
Myth.
So second one is, freezing eggs too early is pointless.
Myth.
Okay. Egg freezing causes early menopause.
Myth.
It's a very big myth in that
case,
because
definitely.
It's a conversation that kind of happens
this is
very
something
often.
This is something I want everybody to understand. It's only focusing on the eggs that are coming in a particular cycle, not on your bank of eggs.
Right.
So it's not going to cause menopause.
No, I think that concept was pretty cool, the FD concept. I think most people will sort of understand that. The next one is, frozen eggs lose quality over time.
Myth.
IVF is a painful process.
Myth.
PCOS or endometriosis patients can't freeze eggs.
Myth.
Okay.
They should.
Okay. Egg freezing affects natural fertility.
Myth. Biggest myth.
IVF babies are less healthy.
Myth.
Okay. IVF babies are born via C-section.
Biggest myth.
Okay. I also want to touch upon two aspects. One is that what would be one advice that you would give to somebody who's running in their 30s, both from a health perspective and from an egg freezing perspective?
Okay, so very basic thing first of all is be aware of your body, be aware of your fertility journey. By doing the basics, get an ultrasound done and get an AMH tested. The biggest gift that you can give to yourself or a female in their 30s is to get your fertility tested, because that is going to give you a good correlation between when and how things are to be done.
Okay.
Because if we are in a spot in our lives where we don't know what we want to do in the next 3 years, at least this is going to be a deciding factor whether to get pregnant or to freeze eggs.
Got it. I understand.
And second, as I say, a good lifestyle, good sleep, good diet, exercise
Those are
goes
the
without
things.
saying.
Got it. And tell me maybe a one interesting case that you still have in your memory.
So I think this case I've quoted quite a number of times. Not related to egg freezing though, it's related to IVF. I had a female who was 45, 46-year-old. She'd lost her son in an accident. She came to us at a stage where she had very less number of eggs. Her AMH was very less. We ran a cycle on her which was unsuccessful. We ran another cycle which was unsuccessful. Then we ran the third cycle. We just barely made 2 embryos which were average quality. She got pregnant in that.
Wow.
And today she's I think 5 or 6 months pregnant.
Wow, that's pretty cool.
So she'd done everything that she could, go to every baba, go to every tantric and everything, but nothing helped. So
Are people very open to talking about other things when they come to a clinic?
yeah, sure. They tell us we'd gone to this and this guru, we'd gone to this and this tantric, we'd gone to this person or that person. They told us this to do or that to do, which don't have a lot of relevance when it comes to medically treating this condition. But yeah, Indians do still believe in this science.
Right. With this, we end the episode. Thank you so much for joining in
Most
today.
welcome, my pleasure.